Paul Harris, the founder of Rotary, struggled to find something that would keep a group of busy professionals meeting each week. He soon realized that efforts to improve the lives of others would provide the needed motivation. This unique idea of service to others created the world's first service club. In 1916, Flint Rotary's first service project was a flower box placed on the upriver side of the Saginaw Street Bridge. A placard stated that this was a city improvement effort by the Rotary Club of Flint. This prompted many comments, most of which were, "What's a Rotary Club?" In 1918, our club met at the Hotel Dresden. Singing was an important part of the meeting, so Rotary bought a piano for the hotel dining room. In 1922, our club moved to the Hotel Durant, which already had a piano. No longer needing its musical instrument, our club held a raffle. The winner promptly auctioned off the piano and donated several $100s to Flint Rotary. For some time, our club had been searching for a meaningful project, and this money underwrote what would become our club's longest-running project, improving the lives of crippled children. The year was 1928. During this era, polio was endemic, crippling young children. Flint had no orthopedic facilities, so Rotarians volunteering their time and personal automobiles made weekly trips taking stricken children to the U of M hospital for treatment. As a side note, Tony Mansour, past president of our club, was one of the children driven to Ann Arbor, and Al Kogel, the teenage son of a Rotarian, remembers his dad volunteering him to be one of the drivers. In 1939, Dr. Hiram Branch, an orthopedic surgeon, came to Flint, and soon after Hurley Hospital was approved for orthopedic patients. No longer needing to transport kids to Ann Arbor for treatment, our project entered a new phase. Flint Rotary employed a full-time nurse and medical secretary and established the Flint Rotary Crippled Children's Clinic. Dr. Branch, a Rotarian, volunteered his services for examinations 2 days a week. Flint Rotary proudly supported the clinic for nearly 40 years, with its entire cost paid for by pledges from our members. Here we see Rotarians Dick Cordell and Dr. Corey Cookingham with Dr. Branch during an examination. The Rotary Orthopedic Clinic provided clinical examinations, x-rays, modified shoes, and braces. In 1928, the program's first year, 26 children were served. By 1971, the program was handling 1,100 clients annually. The Flint Rotary Crippled Children's Clinic moved from Hurley to the newly completed Mott Children's Health Center in 1962. It continued there entirely supported by our club until it was integrated into the health center's program in 1975. Over half a century, our club's orthopedic clinic improved the lives of more than 50,000 local kids. By 1969, polio vaccinations had virtually eliminated new childhood victims. Our focus changed again, this time toward improving the lives of children previously afflicted. From 1969 through 1978, Flint Rotary sponsored 30 crippled children annually to Camp Grace Bentley, a special services camp for crippled children. Once again, changing conditions have caused us to refocus. Our commitment today is global and targeted to eradicating polio forever. Since 1985, Flint Rotarians have contributed $79,864 in support of RI's Polio Plus campaign. The campaign is predicting the global elimination of polio by 2018. Thanks, Flint Rotarians, for your 8 decades of service to crippled children. In closing, let me quote Flint Rotarian C.S. Mott, who in 1939 stated, "If anyone is going to do anything on earth to improve humanity, doing something for children is a good place to start."